And while one foodborne outbreak is ending, a bacterial infection is starting to take root in the South. 7 deaths have been reported in Florida and Louisiana related to this flesh-eating bacteria. It's a rare strand of the bacteria known for rapidly eating human tissue. Most people contract it by eating raw shellfish, but you can also be infected by swimming with an open sore or wound. Extreme cases are often life-threatening, requiring intensive care or limb amputation. Here now, physician and senior public health contributor for Forbes, Dr. Omer Awan. Doctor, thank you so much for weighing in on this. Scary. How quickly do these infections progress when they're contracted, and how severe are the symptoms?
Yeah, they're definitely very scary. They can progress very rapidly. So if you have an open wound and you are infected by Vibrio vulnificus, which is the name of the bacteria that causes this infection, we're talking about hours, literally 4 or 5 hours up to 16 hours after you've been infected with the bacteria. If you've been infected by eating contaminated shellfish, then it can take about 1 to 3 days. And your symptoms really depend on how you were infected. So if you are infected by eating contaminated or raw shellfish, you're typically going to have fever, vomiting, nausea, abdominal pain. If you've been infected through an open wound or an open cut, then you're going to have fever as well, but then also redness, swelling, pain at the site, and maybe drainage from that wound. So definitely different symptoms based on how you were infected with this particular bacteria.
Well, that is an important distinction, and I would imagine getting to the hospital ASAP would be critical in these cases. We have 7 deaths reported in Florida and Louisiana coast. What sort of preventative measures can people take to make sure they don't contract an infection like this?
Absolutely, Kelly. So one thing you can do is if you are getting infected through the contaminated shellfish, make sure you cook thoroughly that shellfish or oyster. Typically patients are getting these infections by eating raw or contaminated shellfish. For those that are getting infected through swimming in warm coastal waters, it's important to apply a waterproof bandage or dressing over that wound or over that small cut. That can significantly decrease your risk, essentially eliminate your risk from getting infected from Vibrio vulnificus.
And around 80,000 people reportedly contract this every year, but the CDC says 1 in 5 can die from severe infection, with it often requiring amputation. So what typically makes severe cases different? Is it the time people take in seeking care? Is that a big piece of the puzzle here?
It's part of it, definitely, Kelly. So one of it is it progresses very rapidly. Once you have an open wound and you have that bacteria that seeps into the skin, then it can spread into the muscle, and then unfortunately it can even go into your bloodstream, and then that can cause rapid damage to different organs in your body and then ultimately lead to death. So again, 1 in 5 individuals. Overall, a very rare disease, I must say, but 20% of cases will end up in death. That's one of the major problems. And of course, it can cause sepsis because it gets into the bloodstream and then it can become very deadly. So definitely, if you start to notice that you have pain around a wound and it's getting worse very quickly, time is of the essence. You really want to get medical attention immediately, go to the hospital, get antibiotics, get the treatment you need so you don't have an unfavorable outcome.
Yeah, seek care so this doesn't get considerably worse. Dr. Omer Awan, we always value your insights. Thank you.
Thanks, Kelly.